Hello, everyone, and welcome to episode 5 of our series. I'm Dr. Gabriela Ilie, and today's conversation is one I hope will stay with you long after you've listened. When we talk about cancer, we often focus on statistics, treatments, or survivorship rates. But the reality is that behind every number, there is a life rich with dreams, hopes, relationships, challenges, and identities that shape the experience of illness in profound ways. Today, we're honored to hear from Matthew, a participant in the Prostate Cancer Patient Empowerment Program, who shares his personal journey through diagnosis, treatment, healing, and rediscovery. Matthew's story is not just about confronting prostate cancer. It's about what it means to face vulnerability with courage and to reclaim one's life and identity in the aftermath. As a gay man, Matthew offers an important and often underrepresented perspective in the prostate cancer community, and that is a reminder that healing must be as inclusive as it is empowering. He speaks candidly about the sudden interruption of a life that was bumbling along, the emotional landscape of facing mortality, and the small daily acts of resilience that made all the difference. Through his journey, we're invited to reflect on the power of early detection, the role of supportive programs like PC-PEP, and the vital importance of seeing every patient in all their complexity with openness and compassion. The Prostate Cancer Patient Empowerment Program, PC-PEP, is developed here in Nova Scotia and is now available worldwide, from New Zealand to South Africa to Europe and Australia. It is about more than survival. It's about helping individuals reclaim agency, dignity, and hope. Thank you for joining us today. Let's listen, learn, and honor the richness of stories like Matthew's, stories that remind us that healing is not just about the body, it's about the whole person. Welcome, everyone. Matt, it's such a pleasure to have you on this podcast. Thank you so much for agreeing to be here today and talk to me.
Oh, no, you're most welcome. I was glad to do it.
Yeah. I just want to start with perhaps you telling us a little bit about your journey. Where were you? What was happening in your life at the time you got diagnosed, and how did things roll from there?
Yeah, I guess I always use the term bimbling along. My life was just sort of going along, very dull, very boring, usual sort of, I was in my 50s, trying to take care of my health, trying to keep my weight at a reasonable level, trying to think about what I can do to live a long and happy life. And I've actually, I think I was in my early 40s, and I just moved to Canada and went to my doctor and said, I'm in my 40s now. Is there something like I should be doing? And he said, let's do a load of tests, let's put you through all the blood tests. We then discovered I had a cholesterol problem, which was probably the worst thing that came out of those tests. But I think actually at the time, I remember looking at the list of boxes that he'd checked, and I think he was actually checking my PSA even at that time, which
in your 40s. Wow.
yeah,
Very good.
which is impressive. I've
Yeah,
now found out that is
impressive. Go
impressive.
doc, go doc.
Yeah, and basically, I've because of my cholesterol issue, which is under control, but I've had like blood tests every year just to keep an eye on that. And I believe, although I didn't put any effort into remembering, I think I've always had a PSA test around that same time. So early in 2022, I was now, since the pandemic, of course, doctor's appointments can be by phone. So I was in a meeting at work, and my doctor called, and it was my blood test results, and I was expecting everything to be absolutely normal as usual, quick on, he'll renew my prescription for statins, and that was it. And I found that he said, well, there's been a bit of a little slight raise in your PSA levels. It's not in the unusual zone or not in a danger zone. So if you want, we can just ignore it. Or if you want, I could perhaps give you another test in 6 months' time. So being a bit of a cautious individual, I said, yeah, let's test it again in 6 months' time. I'm somebody who'd rather know than just ignore things. So I thought, okay, well, let's just do it again in 6 months' time. And of course, 6 months' time, things had spiked a little bit at that time. So, I wasn't expecting anything unusual, but my doctor, again, a telephone appointment, he phoned me up and said, I'm going to refer you on to a urologist to meet with him. So
Mhm.
I did that. He wanted to send me, of course, for a biopsy. I had done a little bit of research about the fact that, some of this debate about whether PSAs are a good test and false positives, and also perhaps some of the dangers of infection from biopsy. So I was a little bit sort of
Mhm.
hesitant. And so what we decided, I think we'd do is we'd do another test, which actually was lower than the spike, but it was still outside the normal zone for a man in his 50s. So I decided, so we're now talking about October that same year. So by that time, I agreed that I'd go and have a biopsy, and just, one way or another, we'll find out
Mhm.
what's
Mhm.
happening,
Yeah.
basically. Of course, it's never that simple, is it? Because my results for the biopsy were they took 12 samples,
Mhm.
which, I mean, the whole experience is really unpleasant. I felt like the noise is like a staple gun, and I've always worked in education, so we've put things on bulletin boards with staple guns, and this sort of kadunk kadunk noise was happening, and so it wasn't the nicest experience in the world.
Mm.
The staff were amazing. This was down in Halifax, and they were so kind and so nice. It made a pretty horrible experience slightly more humane, I would say. But the results were I had something in one in the of the cores. I think they took 12. 11 were fine. There was nothing there. But in one of the samples was something called ASAP, which I can't remember what it stands for. But it's a slight abnormality of the cells, and it's sort of when people who knew I was having the biopsy I spoke to, I said, it neither says I have cancer nor it says I don't have
You
cancer.
don't.
It sort
Yeah.
of just doesn't really know.
Mhm.
So I went back.
Abnormal growth.
That's right.
Mhm.
Yeah. So the urologist said, of course, he said, the people who do the biopsy, their report suggested that I just went and did another biopsy. I was not keen after, to immediately do the same, because I wasn't sure what would actually occur.
Yeah.
They could keep doing that, multiple times, and still be inconclusive. And of course, there is that risk of infection from the
Yeah.
biopsy, and also the unpleasantness of the experience as well. So what we decided instead is we'd wait for an MRI. Um,
Mm. Good call.
and what they were saying was, the urologist said, well, I'm not sure the criteria. You're not really an emergency.
Mm.
There's nothing, that's really going to sort
Mm.
of put you up that list particularly highly. It could be a year. You could be waiting a year. And he said, in the
Yeah.
meantime, we'll continue to monitor your PSA levels.
Mhm.
But actually, I was very pleased, that I got an appointment. I think it was about 4 months later. Uh,
Wow.
yeah.
Mhm.
So went off for the MRI. It was one of every medical experience, every medical appointment. I mean, I live about an hour's drive from Halifax, so and I'm took my husband along with me because I wanted to. In fact, he came to most of our appointments because I have this terrible habit of, like, I think I will remember everything. It's all very clear when you're sat in the office. Do you have any questions? No, no, everything's very clear.
Right.
Walk out that
So
door
typical,
and
right?
immediately forget a whole lot.
Exactly. And what did he
What did he
say? And
say?
what am I
That was it.
supposed to do now?
Was it high or low? Was that a good thing? Was that a bad thing? All
Oh
those sort of
my
things.
goodness.
So I
Again,
took
another good call to
That's
bring him
right.
along. Yeah.
Took Adrian, because I think even if you take a notepad and pen, it's really easy to
Mm.
forget to write the things that you really want to
Hmm.
remember. So
Totally.
I would sort of nudge him and say, could you make a note of that, and particularly like numbers and
Hmm.
things, because I'd started doing a little bit of research.
Yeah.
And I think one of my tips, if we get to that sort of perhaps towards the end of our discussion, is one of my things is do your research, but not too
Totally.
much. It's
But
a
not too much.
it's a bit like the food,
Yeah,
like
yeah.
it's
Eat
because
food, mostly plant, not too much.
yes, that's right. Because I think if you do too much, you end up
Mm.
disappearing down rabbit holes that are not necessarily good for your mental health.
Mm-hmm.
I think
Mm-hmm.
sometimes you can end up coming across material that is of dubious validity.
Yeah.
Um,
Yeah.
so yeah, but yeah, so we got to the
It's
MRI.
hard to navigate when there's so much, right?
Oh yeah,
Because then
yeah.
who's going to be the guide? Whether you go on
Mm,
this pathway or that pathway, because it's just you and the internet and the information. That's the thing, and it's so overwhelming. And because we lack perspective to judge it, to evaluate it, to make it to see whether it fits us or not, it makes it difficult for us to know where to go. And is that overwhelming feeling? Now what?
that's
Now
right.
what am I supposed to do? Where's the doctor? Doc, what do you think of this? What do you think?
And also, I mean, I
Yeah.
wasn't connected with PC-PEP at that point because I didn't have a
Mm-hmm.
diagnosis.
Totally.
I did join a group on Facebook, and it was actually a group for gay men to discuss prostate cancer. And
Nice.
but again, like even with support groups, is you have to be a little bit careful because sometimes
Yeah.
there is a lot of different experiences, and of
Totally.
course, somebody else's experience is not going to be your experience.
Mm.
So
Yeah, it's
it
true.
can be alarming, when
Yeah.
you hear some people have some quite, really serious, difficult situations that they want to discuss,
Yeah.
and you're not even diagnosed. You read those and oh my gosh, is that me?
Hmm.
Like, is
Yeah,
is
yeah,
that what I've got
exactly.
to look forward to?
Yeah.
But went for the MRI.
Hmm.
Not an unpleasant experience. I'm not claustrophobic, thankfully. So actually, lying still in a tube for 30 minutes was quite restful, quite mindful, I would think. They put headphones on, and you have a choice
Hmm.
of different music that you can listen to. But the results of that, unfortunately, were not encouraging. There's a scale for MRIs in prostate cancer, and I think it's a 1 to 5. PIRADS, it's called. Sounds like pirates,
Hmm.
but it's PIRADS. And I think I came out. Is it 1 to 5? I can't remember actually, but I think I came out as a 4, which means that the chances are there is something
There.
significant there. There is something that is likely to be cancer,
Malignant.
but it's not a diagnosis. It's
Right.
just this is, I think they use the word clinically significant chance of it being
Hmm.
cancer. So
Right.
so at this point, when my urologist said, well, I think you're best off having another biopsy, I said yes, yeah,
Hmm.
let's get that sorted out. And I think the difference between when I made that decision not to previously was that there was nothing really that for them to like
Yeah. Well,
fire
yeah.
at.
12 cores, only one comes
That's right.
dubious. Right. Makes
So,
perfect sense at
so the
that time
interesting
to
thing I
say
said to the
no to a second one.
That's
Yeah.
right. I said to the urologist, I said, does that mean that now that they know like roughly which area they're firing at, they'll do less samples? And he said, well, actually, they usually do more samples. So,
Wow.
so
Wow.
I was like, oh, that was not what I wanted to hear.
I
But
hear ya.
yeah, off I went again for the biopsy, and then I think it was they did 14 cores, so slightly more than,
Hmm.
than before, and I think it was two of them did actually test positive that it was prostate cancer. Now this was actually pretty much a year after, I think 11 months after I first met my
Hmm.
urologist. So this
Hmm.
was a long process even to get a result.
And the idea was that it was localized, right? So
It was.
that's
Yes.
how it was characterized as localized disease.
Yes, it was.
Yeah, yeah.
It was,
Which is of course a good thing in a way, right? So it hasn't metastasized anywhere,
No.
which would make it easier and probably make you a better candidate for surgery.
Yes.
Hmm.
Yeah, it was. I think it was the. I think it was a Gleason 7,
Yeah.
and
Oh, I see. Wow.
I remember that. I mean, I found I actually I now sometimes because I had done a little bit of research, I asked questions, and
Yeah.
so you're never really sure whether if I didn't ask the question, would I get the answer. But
Hmm.
I felt that I was almost guiding that meeting with the urologist at that time, asking things like, well, what's the Gleason score? And I remember him, telling me. And then he said it was a 4+3, and I said, oh, I said one of those is better than the other. Is that the better one or the worse one? And he said, that's the worst one. Unfortunately, it meant that a 3+4 is better than a 4+3. So, but I had to ask that question, and then I was asked if I could make a decision about whether I actually wanted to look at brachytherapy, the
Right.
active seeds, or a radical prostatectomy, which would be the surgery. And my answer was, well, can I talk to someone about both? And at this point, the answer was, no. Well, you have to make you yes, possibly, but you have to make a decision. Which one? Who do you want to see first? Do you want to see the someone who because it'll be a radiation oncologist for brachytherapy, or it'll be a surgeon for the surgery? And I said, I think I need I need a few days to just think about it really and do a little bit of more research. I mean, this was the time I was being told I have cancer. I walked into the room pretty much sure that that was probably the likely outcome. I'd had a year to think about things and these different, no, it's inconclusive, and then PIRADS 4 in the MRI. So I was pretty
Hmm.
sure that was what was going to be told, but it's still a shock. It's still a shock to
Absolutely.
be told
And
you've
good
got
for
cancer.
you to say, let me think about this. I just let me land on
Mm,
this news first and this discussion, and let me arrive at that first, and then think about it and make sure that I know.
yeah.
Good for
And
you
then,
for giving yourself that space, I guess. That's
yes.
rare because most of the time we just go with the flow. There is no time. Everything is moving so fast, and we move from one decision to another without fully being present, without fully agreeing with it or feeling we're in alignment. It's no, honest to goodness, in
Yeah.
general in life it's
Yes.
hard to say, and good for you. What a great example to say,
Well,
let me think
it's
about this.
and I think it was genuine. I really didn't know. I didn't know what was best, and I had heard of um, treatment regret. The
Yeah.
people that actually done one and want and wish they'd done the other. And interestingly, I've talked to a few
Yeah.
men who've made the decision, and I think a lot of people, other people I've spoken to, have said, "Oh, I knew as soon as I was going to go for surgery, or I was going to go
Hmm.
for brachy, or they were quite convinced at that point that they knew, but I really was not. I really didn't know which one I wanted. So I spent a couple of days and decided I was going to go for brachytherapy. I actually did. I connected to a couple of men who I just reached out to out of the blue from the one Facebook group I was part of. I did a search for
Hmm.
brachytherapy. Somebody, although they were in the US, were connected to they were a friend of a friend on Facebook, which is just funny how a Canadian friend, a Nova Scotian friend, just knew this person through some other means. Um,
Yeah.
and he turned out, he said, did you know before I reached out that I'm an MD, a medical doctor? And I was like, no. In fact, I probably wouldn't have actually had the cheek to ask you the questions if I'd known. Um, but he told me about his experience with brachytherapy and was,
Hmm.
and it was relatively a positive one. So that was the route I thought I was going to go down.
Yeah.
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 Gosh, this is a long story. I'm sorry.
No, no, this is
Your,
so good.
your
So this
listeners
is
will
so
all be
good.
asleep by now. So hopefully no one's driving. Stay awake. Come on, everybody.
Yeah. Awake now. Okay.
Yeah. Um,
Yeah.
so then the next stage, so I ended up having an appointment to see a radiation oncologist, and I would say, and it wasn't the radiation oncologist's fault, but this, when sometimes it's just like you just have the worst experience of,
Hmm.
and um, down we went
So,
along.
so what was worse about? Was it the communication, the interaction? Was it because I'm thinking the first thought that came to mind when you said that is just my goodness, radiation oncologists, surgeons, they're just people. What if they're
Yeah.
just having a bad day? And I
And
mean, really, we
Well,
all
and
have a bad
also
day.
it was a bad day. I
It
mean,
was a bad day,
it
yeah.
was a bad day. I mean,
Mm.
we got down to Halifax, and managed to find parking at the hospital, which is always a little bit of a challenge anyway. Um, it was August. It was one of those really humid, and there was a thunderstorm coming, and so it was close,
And there is Matt arriving at the hospital.
and we walked in, and
Yeah.
this was in, I had really high expectations because like I've got a diagnosis of cancer now. This is what
Serious.
this is serious. This is serious stuff. Everybody will, like move around and make sure that everything works perfectly for me.
Yeah, yeah, yeah.
I, I think it was, I think we were, so we sat in the waiting area. The receptionist was a little offhand, and that never helps, And I'm sure she was having a horrible day and things, but
Mhm.
it was just sort of, there were
Mhm.
when you go into a reception area, if there's lots of signs about what you shouldn't do, you always know that there is some sort of dysfunction going on.
Mhm.
And so that was the first thing, not a big thing. Sat down,
Mhm.
waited, not a problem. Um, then was shown into a windowless room. And of course, like I said, this is a stormy day. So you can start feeling, you felt almost like there would be condensation running down the walls. It was humid, it was hot, the windowless room. We sat there. Um, I think everything was delayed. Everything on that day was delayed, and then the nurse came in. And again, I think I was probably starting to get grumpy at this point. So I'm also, I take
The
responsibility
tension is building.
for that
The tension
experience.
is building. It feels backwards. It just doesn't feel,
Yeah. And
yeah,
then
as a
and
flow.
then the
Mm.
question was, and I was asked twice if I was still working. And the
Mhm.
tone was, "Are you still working?" was the question, and I said, "Yes, I'm 55." And I know freedom 55, but not when you've got not in my life, I can tell you anyway. With pension in the UK, pension in Canada, I don't know. It'll probably be freedom 85 for me, I think. I don't know. But I said, yeah, oh
Oh.
yes, I'm still working.
Mhm.
And then the questions were, are
Mhm.
you steady on your feet? And and I know, I've actually,
Mm.
I've since this experience, I've had a it's a standard question. I've
Yes,
now
yes,
realized
yes,
that,
yes.
but it was like, yes, I'm steady on my feet.
Yeah, yeah.
And then it was like, oh yes, you said you were still working. And I said, yes, I'm
Mm.
still working. Yeah. And so I know we're wearing masks. This is, post-COVID and everything. But I just thought, oh my gosh, I feel like I'm
Mhm.
95 in this,
Mhm.
in this experience. And then I was given a questionnaire to fill in about, I think the nurse left the room. And I think it was because this was a questionnaire about sexual activity. So you needed some privacy. And going through the questions, I felt like we were in 1956. The questions were not only very heterosexual based, which I probably would have expected. They were
Mhm.
almost they implied that the only sexual activity is between a man and a woman, and it is probably in the missionary position, and it is penetrative vaginal sex. That was the tone of this questionnaire. So of course, again, so all these little, and these are little things. Any
Yeah.
of them individually probably wouldn't have wound me up. And then and then the oncologist comes in and he has a student with him. And by this point, my level of tolerance for this whole experience was probably like low. So I do take responsibility. It wasn't just them. It was by this point.
Oh, I just so much appreciate your heartfulness. I just so much appreciate this. Yeah, yeah,
And and
it's
and
perfect. And
I
and I
hope
love the humor too because we're human. We're all human.
yes.
Do you know how many times I'm sure we can all identify with a situation like this? We go to, and it's just things are not lining up. I'm sorry,
No.
and we're not seen, and we feel like, oh, I'm singled out. It's like there's something wrong with me. Like, hello. It's
Yes,
it's hard. It's
it is.
it's difficult. It's difficult for everybody. It's difficult for us. It's difficult for them. Yeah, yeah. Very interesting. Okay, so they're coming in. They're
Yes.
coming in.
And of course, this is a very small room. There's myself, my
Hmm.
husband,
Hmm.
radiation oncologist, and a student, and we sort of crammed into this space. And
I
so,
don't even know who to feel more sorry for, them or you,
yeah,
all of you. It's
I
like,
think then because I probably, if you probably read my face, they probably thought, like this is not a nice man because actually, I was probably by this point,
oh no.
I probably wasn't hiding my, my slight sort of like grumpiness,
Oh, but
and
they have experience. They know
I'm
this is,
sure they do.
yeah,
Yeah.
yeah.
And it turns out,
Oh,
so the first thing, really he was able to say to me is, I don't qualify for brachytherapy.
okay.
My prostate was enlarged to
Oh,
such an extent, and he said, I mean, he said they have a grid that they put over the MRI.
yeah,
And
yeah,
I mean, it sounded like, remember that game Battleships, where
yeah, yeah,
so basically the grid that he puts over the MRA of your
yeah.
prostate. Well, apparently mine did not fit in the grid. So
Hmm. Yeah,
the
yeah, yeah. And that's very important for Bracky.
yeah, and he
Yeah,
said,
I
I think your
remember.
prostate can hide behind
Yeah, yeah,
your
yeah.
pelvis,
Oh,
or
totally.
yeah.
And
So
precision, it's key with
that's
Bracky.
right.
Yeah,
You don't want to, yeah.
key.
Now, so
Mm.
that was pretty much like out within 5 minutes. This is like 2 hours,
That was
two
quick.
hours, 2 hours of waiting, and 5 minutes later we're told that everything,
Yeah.
the decision that I had put so much effort into researching and like deciding this was for me, was then thrown out of the window. That was gone, completely. We left we left the cancer center, and the heavens opened. The rain, it was, we walked to the car,
Ooh.
and I to say the expression wet through to the skin was not adequate to describe how wet, because the
Wow.
the building of the tension of this day with the thunderstorm had suddenly released, in many ways. You see, it's funny because I am not a spiritual person, in any way, shape, or form. I'm not a religious man. I don't really, I don't believe in any higher being. But it was like, this was so. I mean, it's either like a Charlotte Bronte novel or something. I mean, it was. If you'd written this as a story, nobody. Oh yes, it's like with the rain just at that point. It
It cracked your soul open, didn't it? That
it
rain
was.
cracked your soul open.
It was. So I got to the
Yeah.
car. It was. So how wet it was is I used my phone for GPS. I plugged it in, and the screen on my phone said, "You can't charge this phone because it's too wet." So, and this was my phone that was in my pocket. So this is how wet it was. And the plan is actually, I think for this one, I had driven down from work, and
Hmm.
Adrian had driven down from home. So we'd each traveled over an hour to meet up.
Mm.
We met up out of Halifax because parking is so difficult. And then we were going to just disappear in our separate ways after this meeting because we knew that this was not, all this was going to do was like informational meeting. This was not
Right.
diagnostic or anything. So,
Yeah.
we were going to go our own ways. We quickly changed plans because we needed to regroup and actually sort of digest what we'd just A, experienced and B, been told as well. I think my frustration was with some of my research, I had an inkling that perhaps because I have been told by my urologist that my prostate was quite enlarged. And I had listened to a podcast about brachytherapy, and the oncologist said something about, oh yes, I have actually I've even performed it on quite large prostates, and so I got this idea. Well, perhaps I will not be. Oh no, nobody would have put me through this. Um, and I just think in this was so 2022, 2020, yeah, 2020, no, 2023 by now. After the pandemic, could somebody have not looked at my MRI before I drove all the way to Halifax and my husband drove all the way to Halifax and just done a phone
Vetoed that option.
conversation and just said, I'm
Hmm.
really sorry, you're wasting your time coming because you don't qualify. Or my urologist perhaps, have known, or they could have even, like perhaps when my urologist referred, they could have gone back to him and he could have had that in person. If they don't want to tell you that sort of stuff over the phone, I understand. But it was in a rural province like Nova Scotia, getting to medical appointments is a pain. I'm very lucky. I have a job. I still work. I can pay for gas. I've got transport. But still, it was that was annoying, I would say. And of course, the other thing is now all my plan, this is my treatment plan. I had in my head this is what was going to happen, had to be changed. One of the nice things I did say to the oncologist, like, do I now have to go back to my urologist and then get another referral? And he said, no, no, I will refer you to a surgeon. Um, and and he said, he said that I mean, I did have another option. I could have had hormone treatment to try to reduce the size of the prostate, then think
Hmm. Hmm.
brachytherapy,
Hmm.
but that wasn't his advice. The oncologist said to me, um, if I was talking about my brother or a relative, I think I would probably think about surgery in your case. So,
Yeah. Yeah.
which I appreciated. I appreciated
Yeah.
that honesty and that openness
Hmm.
and making it personal like that. So, yeah,
Yeah, because sometimes that can really cut again months and months of frustration because you can say, okay, well, let's try to shrink it. Let's try to do this and that. And what if it doesn't work, right? And then
that's
you
right.
create that expectation. So they really, have to go into all their experience and say, what are the chances? You know, is it worth it? Is it worth the mental anguish?
Mm,
Really? The
mm,
life anguish. I mean, here you are talking about, I live in rural Canada. I have to get to the appointment. And I'm still working. That means my attention and my energy goes into making a living and
mm,
being able to navigate my life as a 55 years young man. And
mm,
now all of a sudden, this new news is being added to the equation and creates so much havoc and,
mm,
and distress. So it's wonderful that you were able to have that conversation to kind of, think together, as to what would be maybe the best solution given the situation. And those are difficult conversations to have. Both parties have to be open. I think a lot of the times oncologists also wait, is it may I suggest something, may I,
yeah,
based on my experience, this is how I feel about this, is that okay?
yes, yeah. No, I mean, it was tough because the other thing you mentioned about working and everything as well is like, who do you tell? Like at this point is
Mhm.
you worry about things like,
Yeah.
is, I have cancer. Is that my career over? Is that, will ever,
Would you treat me differently?
yes, yes,
You
yes. Will
know?
I, it, you suddenly feel, old, you feel like I've got to, even, I mean, I found out since that actually, 55, 56 is young to have prostate cancer.
Yeah.
Um, but you feel old. You feel like I've now got an old man's disease. I am now an old
Hmm.
man. And the
Yeah.
way I was treated with the, steady on the feet and are you still working, added to that, feeling, yeah, and then so you wonder when, when you're wanting to, do the best in your job and everything, are you going to be treated differently by your
Yeah.
superiors, your peers, your colleagues? How is that going to
Hmm.
be? And you keep disappearing off for these pretty much day-long medical appointments by the time you've worked it out.
Yeah.
Um,
Yeah.
so that interferes with
Oh,
work
yeah.
and life and things as well.
Yeah.
So
And a
yeah,
lot of time, a lot of the time, people also, Matt, don't you think? I mean, people also have trouble with this word cancer. It's not even, they don't know how to feel about it. They don't know how to respond to, is the unthinkable. For many people, is the unthinkable. Cancer. Oh my
Mhm.
goodness. So all of a sudden they get so scared that they almost put some, physical difference between them and whomever has cancer just because they can't deal with it.
No.
So it's a personal thing, and so how to disentangle that for us, for you, for anybody with a diagnosis, when it feels so personal. I mean, it all begins with being personal, doesn't it?
Mm.
In those
And I can't
exchanges.
believe that, well, is like another I do get a little bit on my high horse about, like, I can't believe that in 2023, it's that you can actually leave an office
Mm,
of any medical professional being told that you've got cancer and
mm.
not be given like a website, a brochure, anything that talks about mental
To
health,
learn more. Yeah.
knowing that men are
Wow. Wow.
particularly bad as well, talking about
Yeah.
mental health and dealing with our
Yeah.
mental health, or even
Yeah.
admitting that we have.
Oh my goodness, you just opened a can of. I'm so happy you brought this up because our lab and the work that we did, the research that we did, actually, we uncovered a silent epidemic. I mean, even I'm surprised that here is 2016. I start my appointment at Dalhousie University trying to understand what are the complexities that men have to face in light of a prostate cancer diagnosis. And when I uncover, I mean, you look at all the other things that I uncovered, and they were pretty much existing in the literature already out there if you
Mhm.
were to look through the scientific evidence. But when we looked at mental health, that was shocking. That's more than double the rate of men without a prostate cancer diagnosis, whether they have another cancer diagnosis or they don't have one at all. So that says something. So
Mhm.
here, and we uncovered it in independent data sets here in Canada, in Atlantic Canada, but throughout Canada. They uncovered it in Denmark, in Germany, in Australia. Now it's ever in US, right? So everybody knows about it. And you're right. And I also think with respect, I mean, I love your comment about, okay, so I have a prostate cancer diagnosis. There's so little information. Let
Mhm.
me educate myself. So a lot of men just run for the internet because now that's where the source of information is. And I think we are developing faster than we have time to make sense of this and change the way we access information. Right?
Mhm.
Because it used to be 60, 70, 80 years ago. You want to know more information, you go to the library.
Mhm.
That's that.
Yeah.
And then the industrial revolution kicks in and computers kick in, and look at the progress now. Information is at our fingertips,
Mhm.
right? So it seems like we've grown a USB cable.
Yes.
Right,
And,
but our societies haven't adopted to the fact that we all now have, it's almost part of us. There's a USB
mhm.
or a cable that plugs into this mountains of information, and and now we want to get that information in. We're how to navigate those huge amounts of information, to extract the information that we need, to empower ourselves and leave the rest alone so that we're not confused, we're not overwhelmed. That piece is missing. So as a society, we almost have to kind of run and try to adapt to what we have access to. And we're not there yet. So you pointed that out so beautifully. I wanted to talk a little bit about that because I think it's important.
Yeah,
Yeah.
absolutely, and that feeling of overwhelm, because it's not just what you read on the internet. I mean, like I said, I listen to a podcast, so and we're on a podcast. I mean, you can read it on the internet, you
Yeah.
can listen to it, you can watch YouTube videos. There's so much data, so much input.
Yeah.
And again, it's not necessarily filtered to be, to make sure that we've got the credible. And of
Yeah.
course, this was
Yeah.
before I joined the PC-PEP, so it was, like I didn't really have a guide. I didn't.
Yeah.
I was there myself, my husband, my friends. People would say, "Oh, have you tried cannabis oil?"
Yeah.
And
Yeah.
like, have you done this? And I know this somebody who had 6 months to live, and now they're 10 years later, and
Yeah.
because
Yeah.
it's all because of cannabis oil, or it's so there's so much stuff, and you're constantly thinking, how am I processing this? How am I making right decisions? I mean, one good thing I did is during this period of time, one thing I was pretty clear about, um, was I lost about 15 pounds of weight. I decided I was going to get fitter, because whatever I was going to face,
Yeah.
facing it fat or facing it fit, like that was what's going to be the best outcome. And like everything, all the
Yeah.
evidence,
Yeah.
everything is
Yeah.
telling you these days is that
Yeah.
good for your heart. And
Absolutely.
so, I did embark on that bit of a journey, because I just thought that
Yeah.
whatever
Yeah.
happens, whatever,
Yeah.
even if this is not cancer, which I wasn't 100% sure at the time, if I'm on active surveillance, whatever it is
Yeah.
it's not gonna do any harm to lose that weight, because I've, as most people, I was a skinny teenager, and then sort of, as I've been with my husband and I have been together for over 33 years. And, as you get comfortable and nest and things, I do find that it's very easy to put on the weight. And
Yes.
as I've
Yes.
got older, it's been a struggle. So I just
Oh,
decided
totally.
a good time to do something about that. But
Yeah.
otherwise, like that otherwise, what can you do? You're reading all this information, you're listening to all this information, and then decisions that you think then I've got a decision,
Yeah.
brachytherapy or surgery, and then that's taken away from me, that decision, and
Mm.
actually it's really is
Mm.
probably just surgery as my option. So there is a lot. And when we talk about mental health, I will say
Yeah.
is that, I work with a counselor. I work in education, so I've often talked to students about with
Hmm.
delivering bad news,
Yeah.
about grades or their chances of success, or etc. And so I've always been, you should seek help when you need it. So, and I have a very good employee and family assistance program at
Thank
work. So
goodness. Yeah.
I found myself a counselor who I could Zoom with and talk to online,
Mm.
and my employee plan paid for that as well. And
Yeah.
you can, you'll probably guess from this experience that we're having is I used to I logged on and would like rant at him for an hour about like things that were annoying me. But what was really good was actually getting some of the tips and advice of like how to process some of
Mm.
those emotions, those feelings, the research that you were doing, and particularly when
Yeah.
yeah, particularly when you sort of you didn't really know what should I do. You sometimes, and it was very easy, like rabbit holes I've talked about,
Yeah.
but it's also very easy to sort of spiral a little bit about your mental health as well. So you're
Yeah.
thinking about worst case scenarios. You're reading stuff on
Mm.
the internet, and I use the example of work is if it's like what happens if, like, if I lost my job now, I've got cancer, would anyone ever give me another job? Like
Mm.
and why are you thinking about, it's not very logical, but that's
Right.
mental health is not
Yeah.
always logical. You just, I
Totally.
just,
Totally.
and I just remember,
Yeah.
my counselor saying to me, but I used to work in politics for 2 years. I've mainly worked in education, but I worked in politics and I lost my job due to an election because, I
People
said
change.
people
Oh,
change
exactly.
and the staff who work for them have to change as well. And so
Hmm.
I have experienced losing a job at that point, and my counselor
Hmm.
knew this and just said, "Well, what happened then?" And I said, "Well, I managed to find another job." And he's like, "So why do you think that it would be any different now?" And logicked me through, and we talked, and it was so helpful. It was just so
Yeah.
helpful to have
Yeah.
somebody
Yeah.
who, like, I could talk to my
Yeah.
husband, but he'd always
Yeah.
he'd say things, of course you'll get a job because you're amazing, because he
Yeah.
loves,
Yeah. Yeah.
and like, that's, and he's such a, he's my number one fan, as I am his.
Of course. Of course.
It's that's so that's not very objective,
Exactly.
it's
Yeah.
like,
Well,
yeah,
you just say this because you love me.
that's
Just leave me
right.
alone. You don't understand. This is bad. This is really bad.
So it
I
was
know.
nice to have somebody who was like
This
slightly outside and also had the training
exactly.
as well
Yeah.
to be
Yeah.
able to talk
Yeah.
to people.
Yeah, this is why when we put PC-PEP together, I told Rob we need to talk about relationships. We must talk about communication. And Rob was like, "Oh my God, no! I'm an oncologist. I don't talk about. I can't do. This is
Don't do
no,
feelings. Yeah.
no, no." And I said, "No, we need to tell people that we're not our emotions. We're not our feelings. That the feelings come and they go." Just like clouds come and go on a clear day sky, and they're transitory, and we need to look for the permanence, and so on. And Rob was go, "Oh my goodness, this is it. I don't think we can do this." Oh no, but Rob, there's a science and methodology to emotions, to how we process. I don't know about that. And you know about that, but I don't know about that. I'm an oncologist.
Yes.
So
No, it's
very
tough.
important, very
It's tough to
important.
get hold of all that stuff. And I found, I mean, the good thing about having, having prostate cancer as a more mature person is that you've learned a lot of that stuff. I mean, I would say in the past, I don't
Mm.
really do emotions. I'm not
Yeah,
but,
yeah. And
but
especially men, that's especially
oh
valid
gosh,
for
yes.
men. Yeah.
Yes. But I mean, I think one thing that helped with that is when we moved to Canada, we adopted two children, and becoming a parent, you have to do
Ooh,
emotions. You have
totally.
to
They take
survive.
emotions out of you.
They
Like
do. Well, that's
like
it.
the dentist. Come on out. Come on
That's
out.
right.
This
Yeah, they
tooth is
push
coming out.
buttons that couldn't, that you didn't realize that you had, so you need to be able to process that stuff.
Yes.
And then the
Yeah.
other thing I found is through work is I'm a bit of a, through podcasts and things, to be a good manager and leader, you need to be able to be your authentic self. You need to be your
Ooh.
emotional self. And,
Here,
I've
here.
read,
Yes.
Brene Brown
Yes.
that's on the bookshelves behind me and
Totally.
things, is I've
Totally.
realized that actually where I've probably made mistakes in the past is to
Yeah.
try and be like somebody else. Like, how does somebody else manage, and how somebody else do the job that I've got, and realize that actually being me is probably the,
Perfect.
well, probably not, but
Everybody else is
it's the
taken, might as well be ourselves, somebody
that's
once said.
absolutely right.
That's it.
The best I can be. It's like, it's just, it's, flaws and all, but
Oh
actually
my goodness.
being genuine and being open.
Totally.
Actually, and some of that is the emotional side. And, my team at work laugh now when I say, I'm in a bit of a grumpy mood today. And do you
Mm.
know what the answer they give me is, we like Matthew when he's grumpy. Because they say I'm funny because, like, something will wind me up and I'll go into a little bit of a rant about, something
Yeah.
that only insignificant things, like, is, processes that we
Ah.
bureaucratic processes and stuff that oh, Matthew gets, very upset. But it's part of that whole,
Yeah.
that's the way I process things, and being open,
Mhm.
and I've had to,
Yeah.
and I found with this cancer thing, and it still sometimes goes on even after, like, I'm a year out from surgery, but it has changed me. I sometimes have bad days where I'm less resilient, less able to deal with annoying things, or but I think I have learned
Just
to
like me.
talk about it, particularly to my husband, although he may not say the same, because sometimes he'll notice my behavior, the fact that I am getting a little short-tempered, things are annoying me a little bit more. Um, but yeah, it's being able to sort of access that genuineness, I guess, of that sort of the idea that you have to say, this is how I'm feeling, this is what I'm experiencing, and this is why I'm not
Mhm.
being my best self today.
Yeah,
And some days you can't be your best self. It's
absolutely.
not going to work. It's
Mm-mm.
not going to happen.
Mm.
So
Yeah.
yeah.
And to develop that forgiveness towards oneself, that acceptance towards oneself, um, and also be able to identify yourself in others. I mean, I remember years ago listening to this guy talk about podcasts on a podcast, and he said, imagine where would your life be if every time you made a comment about somebody else, especially when you didn't like their behavior, but also when you liked their behavior, you would add three simple words: just like me.
Mm.
Look at that just idiot out there, just like me. But he's so frustrated and he can't see me. He got just like me. It brings such an instant relief and such a uh, there is a love that that replaces that. There's a peace, there's a love, there's a tranquility, there's an acceptance that
Mm.
replaces that sense of frustration that we
Yes.
experience sometimes. And it is those little things. And you mentioned Brené Brown. Shout out to you, Brené. Great work. Thank you for your work. And so many wise people, and you too, Matt. I just love doing those podcasts. I love tapping into people's wisdom and love and fullness to learn things. There's just so much we can learn from each other. And I recognize myself so much in everybody. You,
Mm.
in your story, your story. I've been there. I've been there. I've been frustrated. I've been unseen. I've been,
Mm.
felt violated, and I've been, yeah, I've struggled with things, and you find some peace when, especially when you can laugh at it. Look at it back and just
Yes.
remember to laugh
Oh, yes.
in face of adversity. What a wonderful way of taking our power back.
Mm.
What a
Oh,
great
yes.
way.
I absolutely completely agree. I sometimes worry that I don't take things seriously enough, because, but
No, I love it.
I think we do have to. There is usually a
Yeah.
humorous side in most things and most serious things that we end up dealing with. Again, it's our humanity, like, just like, that you were saying, is that, our empathy with other people, and being in touch with some of that emotional side of us, as well as, the uh, unlike, when people talk about politics on the internet, where they just access their rage and their their hatred, or their why we're different, or the what's wrong, whereas actually, when we spend quality time with people, we tend to access more of, like, where we're in common, what we have that brings us together, and understands each other. So, even, you know, when I was very grumpy on the day that I got soaking wet at the the clinic,
What a great
now
story that is. Uh-huh.
now when I reflect on it, I realize that actually, these were not in any way bad people. It was, and I was also responsible for some of that, as was, I think, the barometric pressure and the oncoming storm. But also,
Oh, and
the
the
way
heat
that the
and the
stress that I was feeling was probably not meaning that I was being my best self as well. So, I think when we access that sort of empathy and just compassion for ourselves and for each other. It really does, like, it makes it a little bit easier, although at the time it's not.
That's not how it feels. Yeah, but what a beautiful story that is, you know?
So
I think,
then, can I
yeah,
contrast? Because actually, the
yeah.
next stage of my story actually was so different. When I actually went to my
Mhm.
surgeon's office, and we went along and again down to Halifax, and both of us came, and I think we're probably, like, I don't know, probably slightly tense because the previous experience was not great, and the first thing the nurse who came and called my name, I have my first name and last name, and can be first names or last names. So she said my name backwards, and so I just said, "Oh, it's
Wrong.
Matthew. Matthew's my first name." And the nurse, just talking about humor. She just looked at me and laughed and said, "Oh my gosh, I do that all the time." And it just cut the tension immediately. She wasn't fazed by it. She didn't,
Mhm.
I would say she didn't care. She just thought, "Oh, like no big deal.
Yeah,
And
exactly.
it was and it went on from that in such a positive, like, vein.
Yeah, yeah.
And within the hour, I'd signed up to say that I was going to have surgery.
Wow.
And
Yeah.
and and my surgeon, who is somebody it was just charming and funny and amazing, incredibly tall. Uh, I'm not very tall, so it was just like he
Yeah,
was like
I
enormously
know.
tall. And the nurse handed me a brochure or a little flyer for the PC-PEP program,
Woohoo! Thank you, Liette.
and it was the first thing I'd been given that I hadn't actually had to find myself.
Yeah.
It was the first piece of advice, website, anything, like they my put something in my clammy little hands to say, you may want to think about this program. It's up to you. It's optional. Some people will, some people won't. It's up, what do you want to do? And I was like, oh yeah, I think I will. I was like, I
Oh,
just read the bullet points, and
yeah.
I don't know what you said on the bro. You could have said anything, but it was like, I will do this, whatever it is, because I was looking for something
Yeah.
to make sense of what was going on
Yeah.
for me.
Yeah.
So I think I went back that day, and I think I filled in the online form,
Yeah.
and I think, did I get a phone call back? And then got sent another
Yeah.
questionnaire, and apparently I was the fastest person ever to fill it in, because this was something everything. I
Yeah.
think my only worry was about how much the time commitment it was going to be, because, like, I'm busy. Um, and like, every day, do you have to do things every
Yeah.
day? That is a commitment. You're asking a lot from us. Um,
Yeah,
and
we do.
you do. But
Yeah.
at a time where I didn't choose to have cancer. I didn't even choose my treatment, because that choice was slightly taken from me. I I couldn't I couldn't influence or change anything that was happening. I couldn't change where my appointments were. I couldn't change the weather. I couldn't change, like, the questions I was being asked that I thought were, asked in a patronizing way. I couldn't change the very heterosexist questionnaire. I couldn't change anything. But one thing I could, so when I got the PC-PEP program, I mean, even the name, patient empowerment, I needed some empowerment, I can tell you. I was not feeling empowered at this point. I was feeling that actually this was all happening to me.
Yeah. Yeah.
The only thing I could control was the research, and that was
Yeah.
sometimes overwhelming, because nobody was
Yeah,
seeing
exactly.
me on it as well.
Yeah.
Um,
Yeah.
and I think actually, I think I was told that you were having a Zoom meeting like a couple of days later for the
Yes.
PC-PEP program.
Yes.
I was told I was going to start. I think it was, yeah, I will start on this date. And I think the next day there was a
Yeah,
Zoom
we start you
call.
on Sunday, and then probably on Tuesday there was
Tuesday.
a
Yeah.
monthly video conference coming up.
Yeah. And
Yeah.
and they say, oh, you may not want to start that. And I was like, yes, yes, everything. Give it all to me
Give it to me. Give it to me.
because this was, I thought, and actually, friends of mine, I have a friend of a friend who had bladder cancer, I think it was, and was just experiencing so many like positive group like support and the way she, and a lot of my experience had been pretty negative up to this point with interactions with the healthcare system. And it's not a criticism. I mean, everybody is so busy. We have an amazing socialized healthcare system in Canada, just like we did in the UK. I'm a big fan of public health and the way we do things. But I still think we could probably do things in a little bit better way just by
Everybody does.
tweaking,
Everybody
tweaking
does.
some
I
stuff.
know. As I
I don't
said,
think
we are, yeah.
it's fundamentally, I think it's amazing. And I think the people who work in the system are amazing.
Mm.
But, like it was not, there were some bits that could have been
Yeah.
better at this point. So when
Yeah.
there was, when I was then thinking, okay, well, when's my turn to have some really positive like things to come out of it? Um, and I hopped onto the Zoom call and started getting the emails and immediately felt that this was probably something that would work well for me. Um, Unlike this one-on-one where I won't stop talking, I'm not a big talker in our big group Zoom meetings. I think that I've done that Myers-Briggs stuff in the past, and I am, I come out as sort of borderline introvert extrovert. One of the things, I love talking to people one-on-one. I'm not I don't work the room. I'm not necessarily going to say, my problem. I want. So
Mhm.
I'm sort of usually quite quiet in there, but I li love listening to other people's experience, and I love the information that we get from you and Rob because we know that you have done the research for us, that you wouldn't say anything that was not well researched and evidence based. And if there are any doubts about it, you'll tell us as well. Well, that some people have said this.
Yeah.
This is what,
Yeah.
you know. So it helps you guide through some of that research. And I love the fact that actually people bring to our Zoom meetings, oh, I read about something else, this thing.
Yeah. I love it too. That's how we
Yeah,
all learn, right?
that's right.
Yeah.
And you can say, oh, either, well, there's not necessarily a lot of evidence in that, or oh, that's new. Let me take it away and have a
Beautiful.
look,
I
and
love
we
it.
come
Yeah.
back, and that is so helpful because most of when you do the internet thing, most of the information comes from the US. A lot of, a for-profit healthcare system where there may be vested interests,
Mhm.
or it's quite frankly, even now you worry about, is it AI generated clickbait?
Right.
Is it
Right.
genuine, or
Yeah.
is it just been taken from other places, or is it plain what I'd call
Mm.
quackery? Is it just complete nonsense?
Mhm.
And
Wow.
post pandemic, we have to be very careful
Mm.
about the information that we
Yeah.
have, that there is the evidence behind it, because that whole that some of that discussion went out of the window where the influences of this world suddenly started telling us things that were not necessarily true. So love the program. My only criticism, PC-PEP, when you first start, and I'd say this to any men who are thinking of doing it, do the program, but the first week is a little overwhelming. You're getting a daily video want to do your Kegels 3 times a day, twice a week doing your exercise. You've got your little thing to stick on your ear and things. It's like I was like, I'm not sure. I don't think I've got the energy or time. This is just like so much.
Those people are nuts.
That's yeah. But stick with it is my answer, is that actually
Oh,
it does get easier.
it
And
does. Yeah.
also and yeah, close your ears, because if it's too much, if it's too much on a particular day, if doing your
Yeah.
Kegels 3 times on
Yes.
that Friday because you're exhausted, then don't do it for that
Totally.
day. But
Take
start
what
again
works for
next week.
you. I love it.
I have met some amazing human beings who I have become good friends with through that group. Um, when I was asked about a buddy, did I want a buddy for the program? And I actually said yes. And I was asked, well, what? I said, well, out gay man, they really need to not be a raging homophobe. Like if they need,
Exactly.
I don't mind whether it's a straight man, a gay man, but I would just want someone
As
who's
long as they're not
not
homophobic and they're
judgmental.
going to look at me. Yeah, exactly.
And actually, on that first call, I
Mm.
got a private message through Zoom from somebody who said, "You look about my age," and actually reached out to me on the basis they had also just joined the
Oh, God.
program, and we worked. And actually, so this was a straight man from elsewhere in Atlantic Canada who
Mhm.
reached out to me on the Zoom call, and actually we then suggested to it that we could
Wow.
be buddies on the program,
Wow.
which we did. And then
Beautiful.
a little bit later, actually, I think we had another gay man had joined the group and had asked specifically for a gay man to be a buddy for the program. And so actually, I
Wow.
think it was Leah actually reached out to me and said, would you consider having a second buddy?
Oh,
And
wow.
so I said, "You're really pushing me outside my comfort zone. I'm an introvert, like, and you're asking me to make phone calls to strangers, and this is like." But and that second buddy.
Mm.
So I said I joined the program 18 months ago. We still connect by
Wow.
phone, either every week or every other week, depending on what's
Beautiful.
going on. And he is an amazing human being
Mm.
who has helped me so much,
Wow.
with sort of, like just being able to talk to somebody who knows exactly the experience that we've had. He did brachytherapy, not surgery, actually. So
Wow.
we had different treatments, but we just clicked, and it was just, so helpful to have somebody to talk about. And we talk about our diets, we talk about exercise, we talk about flax seeds a lot. Because one thing I find is during the program,
Hmm.
one thing I suppose that you probably, and it's probably self-imposed stress, is like, um, so I had surgery on about month 5 of the 6-month program.
Hmm.
So
Hmm.
I'd done quite a lot of the program before I had the surgery.
Yeah.
But you can't help, thinking, have I done enough? Have I eaten enough flax seeds? Have I done enough Kegels?
Am I
Have
eating enough food and not chemicals? Am I
Yes,
moving my body enough? Am I recognizing myself enough in others?
that's right. And so sometimes you just like, so it's useful to have somebody
Mm.
who understands the program to be able to talk about that. And one of the things that we laugh about is like, well, what happens if we ate, one less flax seed than, that with the and our cancer
That
comes
is too
back because
funny.
we ate
That's
one less.
so
But
good.
it's, we
Exactly. Make
using
fun.
humor to
Yes,
to do it.
absolutely.
But it's sort of, it's a way of being able to rationalize some of that stuff.
Hmm.
And we talked about the
Heart
mindfulness
rate
monitor on that.
variability
Yeah.
monitor. Yeah.
And how we both try, we realized we had something in common. We really were a little bit competitive with that, with the machine,
Monitor. Yeah.
with the monitor, to try and do it.
That's so good.
Because it was, yeah, it's tough and everything like that. But Yeah, that's I think that's it
That's
has been a
fantastic.
fantastic experience in that, and the gay men's group, and since I joined the group, there have been two men who have had surgery since me, who I've shared my experience with and little tips and things. And I actually, and before I had my surgery, I reached out to other people, including on that original Facebook group that I joined when I first, even before I was diagnosed. And you know, one of the things that I was told was somebody's telling me, oh, you need to, they put a washing line across their bed so that when they had surgery, they could actually like pull themselves up.
Uh-huh, uh-huh.
And I was like, and so I was worried, like, can I not get out of bed and everything? And I didn't have that problem. And one of the things that when I reflected back on it, I was thinking, is that because of the exercises, the stretches, the core strengthening
Yes.
stuff that we
Yes.
did twice a week, which at the time,
Rehabilitation.
yeah,
Rehabilitation.
prehabilitation, yeah,
Yes.
is
Yeah.
was that one of the reasons why, I physically healed better was because of the work that I did as part of the program. And then, you know, not to mention also the good work from the Kegels, and being able to make sure they had bladder control after surgery and things as well. So I actually I credit when I saw my surgeon about, I think it was a month after my surgery,
Mm-hmm, mm-hmm.
he said to me, you've got to understand you've made a remarkable recovery.
Wow.
And I put that down to a few things. One is I am young for having prostate cancer. Having it at 55 probably does make it easier to recover from surgery.
Yeah.
Um,
Yeah.
I think the skill of the surgeon. I had robotic surgery, and so him and the robot, worked
Woo.
very well together, and so I think that was another factor. But I also think that doing the PC-PEP program also helped with my recovery because it's targeted at the things that you need, like the core strength, and that's where the incisions are going to be, or in your core. So
Mm-hmm.
being able to get out of bed and things, um and put your socks on and stuff and stretch, that is stretching, that is some of the exercises that we were doing. And the Kegels also meant that, I think I had a better recovery post-surgery as well. So, I think those things added together, and I know not everybody can have all of those things, but you can certainly have the PC-PEP program. Sorry, the dog's just got up.
That's fantastic.
But we can, like we can, it is, again, it's like I said before, is when there's so much that you can't influence, it is something that you can do that is going to make a difference, for your recovery and for your health and how you deal with it. And even like I said, the buddy program is good for your mental health because actually you can laugh with somebody who knows that, you can't necessarily make cancer jokes with everybody, but you can make prostate cancer jokes with other men with prostate cancer. Like
Absolutely.
we're allowed to do that. So
Exactly. So some beautiful key points here. You're young. Get your PSA checked.
yes,
Find out. It's, prostate cancer is not an old man's disease.
no.
More and more men in their 50s, 50 years young, get
Mm.
diagnosed. Please check your PSA. Please. It's just a part of the blood work routine. And where it doesn't matter where you are on this planet, you speak English, you have access to the internet, and you have access to your computer, and you can check your email. Check us out, pcpep.org. And we would love to support you in any way possible. It is a 6 months program. It's daily, and really at the end of the 6 month, the work really begins. The reason for which Matt and so many other men are continuing to join us in the monthly video conferences is because we formed a community where we see each other's interests as one's own, and we practice those, pure motherhood stuff in many ways that can really help you prehabilitate before your treatment so that you're more prepared psychologically, mentally, but also physically and emotionally to deal with what's coming after. But even afterwards, those are principles of living that we can all benefit from. Eating foods, not chemical, knowing the difference, knowing what actually nurtures your body and makes you feel strong and decreases inflammation where disease can't grow, or, at least minimize the chances of that happening. Moving your body, recognizing yourself in others, sleep well, having sleep hygiene, communicating with others and with the most important people, loving your pets. Oh, look at him. Look, it's a him or her.
That's a her.
Oh,
That's that.
she's adorable. She's absolutely adorable. All I want to do is just reach out and give her a big hug. But this has been so wonderful. How long ago did you finish PC-PEP? I mean,
It
the 6-month program.
Yes, it would be a year ago now.
A year ago now. Yeah, perfect.
Yeah.
There you have it, a year later, and we're still keeping in touch, and we're empowering each other, and we're talking to each other, and we're thinking of how can this program reach more men, especially gay men.
Yeah.
It's even more harder because there are lots of barriers to access, barriers to empowerment. Very few programs. We are the longest program in the world right now to support men who have received a prostate cancer diagnosis. We're very proud of it, and we're trying. We're normal people. Look, I mean, just look at us.
But
We're simple
it's
people
very
that want to make a
genuine.
difference.
It's very genuine because of that, though, I think as well. It's very accessible, like you said, using the internet, using new technology or modern technology, but it's not difficult to do,
Yeah.
and yeah, you get so much from it. And the other thing is, like we as we get older, we all read things about like our health and I just find there's so many parallels with the work in the PC-PEP program.
Yeah.
I was listening to another podcast and they were talking about like balance, and
Yes.
something the other week on the Zoom call about balance as well. So it's a pretty it's a pretty good guide to living a healthy life as well, which is useful. Because actually, again, it's like, there's all sorts of quackery out there, and it's nice to be involved in something where that actually the information you're getting is going to be, evidence-based and accurate and meaningful and yeah, good for us.
Matt, I so much appreciate your time, your wisdom, your humor, and willingness to talk to me and talk to all of us about your journey. Find it incredibly inspirational. And I urge you, if you're out there listening to this podcast and you think that, the program could benefit you or those around you, please help us get the word out. PC-PEP.org. Check us out. We're normal people, quite informed, but with a huge heart. And all we want to do is help everybody. We all need some help to navigate this very complex world that we find ourselves in, where, because of toxicity and the industrial revolution and the impact that it has had on our food, our air, our water, we do need to be wise in terms of what choices we make. Right. And let us share with you and translate the science and empower you, because from your demonstrations, others learn. And so we build a stronger, healthier, happier community all throughout the world. We can do this. Thank you. Huge thanks, Matt. Huge thanks.
No problem. Thank you.
And this concludes episode number 5 of our podcast. For more information about our programs, please visit PC-PEP.org. Thank you so much for joining us. Until next time, be well and take care of yourself.